Yeah, because patients are being told that their rosacea, for example, is a skin issue. It's not a skin issue. It's almost always, frequently, a gut issue, and it's inflammation manifesting onto their skin. So if you're just putting topicals on the skin, yeah, you might calm it down temporarily, but if you're not getting to the root cause where that inflammation is coming from internally, it's going to keep coming back over and over.
Hello, and welcome to Legends of Longevity with Joseph Entz. I'm your host, and I'm thrilled to have you join me on this journey toward living a longer, healthier, and more vibrant life. This podcast is all about uncovering the secrets to longevity, whether it's groundbreaking advancements in heart health, lifestyle tips to keep you thriving, or inspiring stories of people who've beat the odds. Together, we'll explore the tools, techniques, and mindset shifts that can help you unlock your fullest potential. Whether you're here to learn how to enhance your well-being, support your loved ones, or just stay ahead of the curve in health and wellness, you're in the right place. Let's empower each other to not only live longer, but live stronger. Welcome to Legends of Longevity with your host, Joseph Entz. I got a good one today. It's not often I come across a doc who's so well-read, yet under-recognized, in my opinion, that they got a whole bag of tricks that you may not know about. They got a 30,000 foot perspective of medicine, and they'll get right into your individual problems and help you bird dog it. Melinda Atienza is an internal medicine physician, functional medicine practitioner, integrative health expert based in Scottsdale. Originally from Manila, Philippines, she combines conventional medicine with holistic and root cause approach to help patients optimize for longevity, metabolic health, hormones, cognitive wellness, and overall vitality. Dr. Atienza specializes in obesity medicine, peptides, thyroid health, and bioidentical hormone replacement therapy, with a mission to help patients create personalized paths towards long-term wellness. Welcome, Dr. Atienza.
Thank you. Happy to be here.
Thank you for being here. So I kind of mentioned to you, I was reading up on you some more. I found out about you through Jack Wolfson, our friend, and he's like, stop by her office. She's wicked smart, or whatever he said. And so I went in, and you were like, you have a funny connection to him.
Yeah, we go way back. We went to medical school together. I dated his roommate, actually, so we spent a lot of time together. And then we ultimately ended up doing residency together, internal medicine residency. So I've known Jack a long time. That
goes way back. And you're there in Scottsdale, where there's a lot of really cool innovation in medicine happening.
Yes, a lot of growth in Scottsdale. Patients are moving here, and we're really exploding here in healthcare.
I love it. And I'm lucky in that I get to see 1,000 different clinics a year, how they work, the business model. And the fun part for me is seeing newer business models emerge. Doctors that are unafraid to embrace technology that works, but doesn't fit in the normal medical system. I see from your Instagram and everything else, and from knowing you, that you go to a lot of medical conferences. You're the kind of gal that's not afraid to get a new credential. Like I saw you got some neurology credentials, like no big deal. I'll do 30, 50 hours of class just to get this piece of, but you do it to help your patients. So I'll tell you, that's what makes you unique. Tell me more about your journey and why you act that way.
So, yeah, we're usually seeing patients here after they've seen their primary care doctors, they've been to specialists, they've had lots of tests done, they're suffering, but they're being told that everything's normal. And after years and years of that path, that's when they come to see me as an integrative and functional medicine doctor. And so we're offering root cause medicine. We're not just treating the symptoms, masking the symptoms, managing disease. We're getting to the root cause, and that's how we're helping patients. I would say I'm also, my practice is differentiated from other functional medicine practices around me because instead of just offering medical consultations, I'm offering root cause medicine, but I also include advanced cutting edge technology in my practice to help patients as well.
Yeah, I noticed you had a lot of patient testimonials of the M-Wave machine.
Exomind, M-Sculpt Neo, yeah, some of these, yeah. Mm-hmm.
Exomind, that's what I meant to say, the Exomind. And they were very convinced that their issues had resolved. But just before we get to that, like you have patients present with rosacea, and you take a step back and go, did you know that may be a gut issue? Let's look into that. Because none of your doctors have figured this out before. So you develop kind of a Dr. House type eye for unique problems.
Yeah, because patients are being told that their rosacea, for example, is a skin issue. It's not a skin issue. It's almost always, frequently, a gut issue, and it's inflammation manifesting onto their skin. So if you're just putting topicals on the skin, yeah, you might calm it down temporarily, but if you're not getting to the root cause where that inflammation is coming from internally, it's going to keep coming back over and over.
Yeah. And so you can solve that by what? Giving them sauerkraut?
No, so we'll actually do testing to look at their gut microbiome. We're going to see if there's too much bad bacteria or not enough of the good bacteria. If they don't have good digestion, if they have inflammation in their gut, if they've got leaky gut. We can actually see this on functional medicine lab testing. You can't see these in the regular labs that patients are getting from their primary care doctors or even gastroenterologists. So we're seeing the people that have already seen those doctors and specialists, had all the tests done, and they're not getting any answers. And then we can do that kind of testing to see where the problem is.
That sounds so crazy now that you can find a doctor that'll tune into it. But it's going to be outside the system that we probably grew up in.
Yeah. I did primary care for over 20 years. I was in that insurance model, that insurance rat race for a very long time. And patients can't get the kind of care they need because we're just managing their disease. We're not curing, we're not treating their disease with that traditional medicine, unfortunately.
Yeah, and not even on the patient side. I got a new client who is a orthopedic surgeon, usually pretty well paid. Everybody, you did well if you're the orthopod. And he said, I got to do concierge work 2 days a week because with the reimbursements coming down and inflation coming up, the insurance wants me to do more, but I can't. I can't do more than 4 or 5 a day or whatever they are. And he's like, so I got to do concierge on the side. And he's doing a clinic which rhymes a lot like yours, where he's got cool therapies for unique problems. Really, yeah, I see it too. I see the industry changing.
Yeah, there's so much more we can do without the insurance because the insurance is really going to dictate how much time I can spend with the patients, what kind of tests I can order, what kind of treatments I can offer, and you can't provide the kind of care patients need or deserve in that model.
So you're very fond of functional medicine because it lets you get down to the root cause, and the way they've got any doctor that's functional medicine credentialed, they've done, it was like 2,000, 3,000 hours of book work.
I don't even know. I don't know. A lot of time, yes.
That's like a full-time job year of their life. Like they're very dedicated providers.
And we never stop learning. Sometimes doctors think, I've learned everything I need to know. I know all the treatments that I need. But you can't stop learning because medicine's always evolving and you need to evolve with it. So the learning never stops. The courses, the reading never stops.
Yeah, it is a group of curious people because they always ask why at the booth and you want to get into it. I totally agree. I totally agree. At A4M, what therapies have you subscribed to and which ones do you think are optimistic for your practice?
We do a lot of bioidentical hormone replacement, peptide therapies, also using exosomes now recently.
Exosomes derived from the patient's DNA or exogenous DNA?
Exogenous, donor. I have recently talked to some companies about the patient's own, but I haven't gone that way yet.
Isn't that amazing that you can take exogenous or somebody's DNA and regrow hair? What you use it for a lot of stuff. Tell me what, please.
Yeah. So anti-aging, facial rejuvenation, hair restoration, even scars and burns, those kinds of things.
Wow. Exosomes. I know there's companies out there like, I'm not recalling their name. Oh my gosh. But they take your hair and they'll cultivate your own exosomes.
Yeah, that company's called Acorn, right? Yeah.
Acorn. Yes, ma'am. And they're popping up everywhere. And then going back to your prebiotics, gut biome. At several conferences, I've seen companies with gut biome replacement therapy, which is a nice way to say.
Okay, like fecal kind of transplant type therapy. Yeah, yeah.
And they're claiming to cure some big things like Alzheimer's.
It's still sort of experimental. It's still controversial right now, but yeah, I think that's in the future for sure.
Right, that one's coming. I do believe, I'm sure you too, like treating your gut biome like an English garden where it's cultivated. You're making sure it's as natural as possible, and that you know that if you eat a bunch of sugar, that candida, that yeast, is just gonna grow like crazy.
And even if you've had to take antibiotics more than 2 or 3 times in your lifetime, or if you've taken prednisone or NSAIDs, things like that, I really think that everyone should have their gut tested at least once in their life. I really think that that should be the standard of care. And leaky gut is becoming more and more prevalent. It's more common than people realize. And you don't even have to have gut symptoms to have leaky gut.
Is leaky gut the glyphosate, or is it the lack of the right bacteria, or is that the same thing?
Well, it is. So our gut lining is supposed to be semi-permeable. It's supposed to allow vitamins, minerals, micronutrients, amino acids to become absorbed from the gut into our circulation so that we can use those nutrients for health, for our cells, our tissues, our organs, for our brain. But leaky gut, what happens is instead of being semi-permeable, it's hyper-permeable. And so bacteria is leaking into our circulation. Undigested food is leaking into our circulation. Pesticides, high fructose corn syrup.
Undigested food?
Undigested food, yeah. And so that's how, gluten and those kinds of things will get into our circulation and then activate our immune system. And then our immune system starts to attack our own healthy tissues. So when we have leaky gut, we're getting foreign materials into our circulation that don't belong there. And so what is our immune system? Our immune system sees those foreign materials and it doesn't recognize them because they're not supposed to be in our bodies. And then our immune system will become activated to help us, to protect us, to destroy and get rid of those things. And then our immune system becomes hyperactivated and stimulated.
That's the best narrative on autoimmune I've heard in a while. That's a really good narrative because most people, no answer on their autoimmune. I was vaccinated wrong or something.
Oh, right. And then the treatments that they're doing are these just very strong biologic drugs with a lot of side effects to suppress your immune system. Not to regulate your immune system, but to suppress it. And, those are very powerful drugs that they're using.
Very powerful drugs. And you also believe the Flexner report is still relevant to today's society. And I'm happy to get into that too. I've read a few books on it. But that would suggest that our medical system isn't so adaptable. If in the Flexner report they said, hey, we're going to kind of do medicine this way for the next 130 years. Is that fair?
Well, yeah, and that's part of the reason, a large part of the reason why doctors don't learn about nutrition in medical school.
The whole herbology science is history now.
But they don't want doctors to learn how to help patients eat healthier so that they can stay healthier. And that was largely because of the Flexner report. But besides nutrition, even just natural holistic therapies to help our bodies heal naturally, allow the bodies to heal. Instead, pharmaceuticals, surgeries. That was promoted by the Flexner report.
Yeah, procedures and pills are the result. All right, let's talk about, you okay talking about history, the last 100 years and how our society, I love this. So 1913, the Flexner report's written, and it kind of says medicine's going to go this way. And in the next decade, you see the herbology schools close down. So grandma knowing how to cure with boiled aspen bark or whatever your local was, that institutional knowledge is only 2 generations old. So you don't know what your grandma knew, and your grandma doesn't know what her grandma's grandma did. And so we have to fight to preserve this knowledge.
Yeah. And herbs have been used in medicine for far, far, far longer than pharmaceuticals have. But they were done away with because of Flexner and Rockefeller and Carnegie, those very influential people.
Yeah. All the medical schools were purchased, bought out, curriculums, teaching curriculums were modified, and the channels of medicine were siloed. So a cardiologist will patch you up, but his job is not to teach you prevention. In fact, nobody in medicine's job is to teach you prevention, unless you've got a good doc that loves you.
No, it was about profits, keeping patients requiring medications was more profitable than curing them.
And that, what you said is a mouthful. In 2005, I was getting my MBA, and a professor said, everything's going subscription in the future. Pretty cool. But no, Napster's here. The promise of the internet is free information for everyone. No way. But some outside influence is taking all our research papers and putting them behind paywalls. And it's not so easy to form societies on nutrition that don't have a certain narrative. It's just funny. Observing this for 20 years and you just as long, you're aware of these trends in medicine that are counter healthy, counterintuitive to what you think should happen. And the food quality is getting worse and worse. Did I go too far?
No. But you know what? I'm finding patients are becoming more aware. There's more patients that are looking for more natural ways, not the pharmaceutical route. Me too. And it makes me hopeful because the pendulum is definitely swinging the other way. People are realizing they're not getting the health care they want from their CPT code system doctors, but what they do want is out there, and they'll have to pay cash for a little bit, and the markets will adapt. But it makes me so happy there's providers that are curious and looking, and they're not happy till they get to the root cause. And when you tell them a crazy story, they want to look it up, like mouthwash quadruples your risk of diabetes. Well, that's a funny fact that nobody's given a satisfying answer to. I actually spoke to a potential new patient today. I do the discovery calls before they sign up with me. And he said, so he's only in his early 30s. He said that let me remember. He was having trouble at work with performance anxiety. So he would have to get up in front of his CEOs and speak. And he was getting anxiety from that. And so he went to see a psychiatrist who prescribed him duloxetine to help him calm down. And when he took it, he was having trouble focusing. Like his ability to focus was impaired. So the doctor prescribed him Ritalin to help him focus. But the Ritalin was raising his blood pressure. So then he was prescribed lisinopril to lower his blood pressure. And he's like, I'm done with this. I don't want this anymore. So that's why he called me to schedule this discovery call to become a potential new patient.
That's so funny. Yeah, people are noticing they're getting these medications stacked up on them. What's the statistic? Like if
treating the side effects with another medication.
If you're 70 or older, then you're on statistically like 7+ medications. There's crazy stats out there for how well guided this, but there's hope. So all right, let's go positive now. Good food solves a lot of problems. Our whole career we heard food is medicine. What diets, what things definitely to avoid, like food, the biggest thing we do.
Yeah, well, I definitely don't think there is one diet for all people. Some people say everyone should be on a carnivore diet or everyone should be on a keto diet or whatever. I don't believe that there is one correct diet for all people. Everybody's unique. Each individual has different needs. But definitely I think that we really need to cut out the sugar and the simple carbohydrates, the inflammatory foods. The processed, ultra processed foods, the seed oils. Definitely we want to use organic and, be conscious of what we're putting into our bodies, because inflammation is what causes all chronic diseases. But we can be actually putting that inflammation into our own bodies by what we eat. And so we have to be paying attention to what are we actually putting in our body. Is this doing me good, or is it going to cause inflammation?
Trisodium phosphate. I was trying so hard to eat really good fruits. And 2 ingredients, apricots, trisodium phosphate. All right, trisodium on Google. I got the smokestack with the industrial waste coming out of it. And I'm like, this is on our food. And they use it on Wheaties to make sure the cereals. You have to be so careful about your foods. I'm echoing what you're saying.
The American diet, even if you're trying to eat healthy, some of it you can't avoid. They're literally putting chemicals in so much of our food.
And we've normalized things like Gatorade, things with vibrant colors.
Foods that are banned in other countries. They won't accept the foods from the United States because of all the health problems they're causing.
They don't even want our wheat. It's that bad.
Our beef, nothing. They don't want any of it.
No, it's pretty bad. And those farms, there was a farm up in Maine that was using human manure to fertilize their farm, and they wanted to be green. And they find out that all of the human waste is toxic, and they can never be a certified green farm.
Oh my God.
That's how bad it is, yeah. Like all the microplastics and forever chemicals and crazy. Exercise. Convince me that exercise is worthwhile.
Oh, well, is there a question about that? Yes, definitely. Exercise is worthwhile. You have to move your body. You have to, move your blood, circulate your blood. We have to build muscle. We're talking about health. We're talking about longevity. We talk about health span. Muscle is the most important thing to improve our longevity and our health span.
All right, so guys that you put on testosterone probably have a foggy head, they feel old, and you give them a shot in the butt, an appropriate dose, which you figured out through blood tests, and what do they tell you the next day?
What they feel better, they have more energy, they have more motivation, their brain is working more clearly.
Yeah, like the single biggest improvement in so many men over 60 is just a little bit of hormone therapy, and they feel so much better. Their skin gets thicker, their muscle mass starts coming back. They wake up in the morning wanting to do projects. I hear that a lot.
To get their motivation back.
You can speak authoritatively on this because you did some research into it. Women, estrogen, cardioprotect of estrogen, and that disappears after menopause?
Yes, it does. So, after our hormones decline, or as the hormones are declining, women are becoming more inflamed, they're becoming more insulin resistant, cholesterol is rising, cortisol is rising, start to see that look pooch, right? So, yeah, these are natural events that occur through this hormonal transition.
Wonderful. And that's just normal. Until like 30, 40 years ago, it was just a mystery. And 10, 15 years ago, they had some faux pas with the hormone replacements.
Oh, yeah, the Women's Health Initiative study in 2002. Prior to 2002, it was the standard of care to prescribe hormone replacement therapy for perimenopausal and postmenopausal women. That was what we were taught to do. But then when that 2002 study came out, the Women's Health Initiative, it said hormones cause breast cancer and blood clots and heart attacks. And overnight, every woman stopped taking her hormones and every doctor stopped prescribing hormones. And we've found out since that study, not long after that study, that the results of that study were all false. The study was poorly done. They used patients that should not have been used in the study, and they didn't interpret the data correctly. And so for over 20 years, women were disadvantaged by not being prescribed hormone replacement therapy.
Yes, they were. And it took a while for that to sort out of the medical system. Like only in the last 5-10 years?
But there have been, really just last year. much more recent than that. But there have been multiple studies since 2002 showing that that study was wrong, that women benefit from hormone replacement, that it's safe, that it's effective. But those studies were ignored. They didn't make the media like the 2002 study did, because that was shock and awe, right? So the studies that came since then, they never made it to the media, and doctors weren't keeping up with the literature. So women were not being prescribed hormone replacement. They were being told, you don't need that, that's dangerous, that's going to cause breast cancer. And it was all false. Until just late last year, the FDA finally took that black box warning away, which shouldn't have been there anyway. And so women have been cheated for the last 20 years.
Like, that's a whole lifetime of menopause.
Yeah, a whole generation of women.
I remember I was at the Mayo Clinic at a heart attack and stroke prevention effort conference, and this lady gave up. She wrote a book called Outliving Your Ovaries, 2012, 2014, somewhere around there. You have a really excellent, well-cogitated argument on hormone replacement, and it's safe, and we'll actually save more lives than we'll lose. And all right, then the big bad Mayo Clinic cardiologist came out, who didn't even see the lecture, just got out of surgery because she's so bad A. She's like, there's never any reason to do hormone. It always kills women. And I remember, like, they were going to fight, which is supreme education and entertainment at an event like that. Somebody had to get between them. But that's how intense it was for a long time. And the people in the system, like the Mayo Clinic, the names that you trust, were wrong for 2 decades. All right. Women's therapy. Any other women's therapy that you think is underutilized?
Thyroid optimization, for sure. Traditional medicine is just looking at the TSH, looking at the T4 only if you're lucky. And so they're not looking at the whole thyroid picture. And so it is definitely, thyroid treatment is not optimized for the majority of people.
No, it's not. I know functional medicine gives special extra education on it that I've attempted several times to understand the T3, T4 pathway. But yeah, you guys got it down cold. My own doctor's talking to me about it. Like, yeah, you can tune this up a little bit. You'll get squeak some more energy out of your body. Is that about right? Or does it improve your metabolism?
Yeah, and they're looking to see that your numbers are in the range. As long as they're anywhere in the range, they're considered normal or they're fine. But in functional medicine, we're making sure your results are in the optimal range. We want to be optimized, not just fine.
Yeah. If I got to lug this body to work, I want it to work well while I'm at work, right? Yeah. Very cool. So thyroid for women. Are you happy with women's imaging, or have you come across any devices for breast cancer screening or any women's diagnostics that you think is a big jump that a lot of women are suffering from because it's just not public or popular?
Yeah, there's new breast imaging that's modernized, that doesn't require, smashing the breast tissue and still getting good imaging. Even with bone density, I'm very disappointed with DEXA scans for bone density. I like combining DEXA. I also like doing REMS, REMS. Oh, I can't tell you what that stands for right now, but it's ultrasound, actually. And so it's not only looking at bone density, which is the same information DEXA gives you, but it's also giving you information about bone quality, the strength of your bones. And so I'm seeing a lot of women for osteoporosis because so many women don't want to be on those osteoporosis drugs. And so I help women to restore bone health, improve their bone health without the bone drugs. So with this REMS, if we're given not just bone density, and we're given the quality of bones, the fragility, bone fragility, that's going to give us a lot more information, because bone density, it tells you how dense your bones are. It doesn't tell you how strong your bones are. And the bone drugs, they do make your bones look more dense on a DEXA scan, because it's preventing the breakdown of the old damaged bone. With bone turnover, we're building new bone and removing old damaged bone. So it's recycling, it's sort of build new and take out the old. but the bone drugs prevent the breakdown of the old bone. So you're accumulating.
Wait, there's bone apoptosis. There's bone senescent cells.
Yeah. So we're accumulating old damaged bone. It's not new healthy bone that it's building. It's accumulating old damaged bone. Yeah, so it looks denser on a DEXA scan, but it's not stronger. And in fact, women have to stop these bone drugs after 5 years because if you take it longer, you actually break your bones. You'll see more hip fractures if you stay on these bone drugs for longer than 5 years because it's just accumulating old, damaged, used bone to make your bones appear denser. We're not strengthening the bones.
That sounds...
And so that's why I like this REMS imaging to look at the density of your bones, but also the quality and the strength of your bones.
That's a good one. And you're going to send me down a perplexity AI rabbit hole looking up that research study. I did not know that 5 years your bones are kind of full or they're not. That's not what I was sold.
Yeah, when those drugs first came out, Fosamax, Actonel, Boniva, those kinds of drugs, we would put women on them and they would just stay on them for indefinitely until they realized that women's bones were breaking when they took those bones long term.
You feel like the sales rep should lead with that on a sales call. That's important stuff. So that whole, I got to read into that because that sounds like a pretty crazy conspiracy that they're, after 5 years, they become less effective.
Yeah, we stopped them at 5 years.
Wow. So you use the REM and some other tools to help women regenerate their bones naturally, which I would assume is the strongest, most long-term solution for these patients.
Yeah, we're also checking bone markers in the blood that give us, information about the rate of how quickly they're breaking down bone and how they're building up bone.
Okay.
Yeah, so there's definitely more than the DEXA scan that we can use to assess bone health.
Yeah, and a lot of these things are not either prescribed by their doctors or they're not standard or they're not even known about. But if a lot of women knew about them, they'd use it because it's definitely better stuff. You use PEMF as well, pulsed electric magnetic frequency, as a therapy.
So we're using frequency-specific microcurrent. So I think we're thinking the similar things. It's an electrical current. It can be converted to magnetic, and that's what PEMF is. But in my clinic, we're using frequency-specific microcurrent.
Okay.
And that, too, speaking of the Flexner report earlier, frequency-specific microcurrent has been around since the early 1900s until it got banned because of the Flexner report. Any doctor, and there were lots of doctors doing it, but they all had to stop or else they'd lose their license or get fined. So they had to stop doing it. It sort of became resurrected again in the 1990s, and so thousands of doctors are again using frequency-specific microcurrent, including myself. Okay,
you're talking about Royal Rife machines, I believe.
Yeah, we're similar. It's not Rife, but it's along those lines.
An evolved, more improved, refined version of the Rife machines. Okay, I have seen those popping up in clinics left and right. Very powerful little machines.
Yeah, it is powerful. It really is. It's effective. It's powerful.
I think we're reading a lot of the same books. So, okay, geek out with me because I'm kind of new at it and I find it hard. I find myself being incredulous that this little machine that can make a frequency is so powerful, right? Tell me what you know. Yeah,
so, frequencies are everywhere. They're in our body. But even you think about your car. You probably have a key fob to open unlock your car. So that's frequency, okay? And your key fob only works on your car. It's not going to work on my car. So frequencies are specific. And so with the frequencies in our own bodies, we have electrical current in our body all the time, every day. Right now, you have electric current going through your body. So every single cell in your body, every type of cell, has its own specific frequency. And, so each kidney cell, each, ovary or lung or intestine, brain, every cell has its unique frequency. And so with frequency-specific microcurrent, the way we use that, so if a cell is injured or damaged or inflamed, due to toxins or illness or whatever, that cell, so say we're talking about a kidney cell, okay? So say a kidney is supposed to be oscillating at a certain frequency, okay? But then it becomes damaged, and then now it's on a different frequency. It's off. And so we'll reintroduce the correct frequency using microcurrent to signal back to that cell the correct frequency, so it's balanced again. So we're using it for gut health, adrenal health, so many things. We use it for pain, inflammation, lots of different things we're using frequency-specific microcurrent.
Okay, I went into a pretty deep dive. I even created a little PDF pamphlet on this topic just because it's so mind-blowing. Let me give the listeners some perspective on things that I think are related to this field, and then we can talk about how powerful it is. So Catholics for thousands of years have had holy water, and they've had special rules about refilling the jug and using the jug because there was a certain energy or something undefined in that water. Okay, that's cool. I've observed that, and it's a persistent rumor. Let's just call it that, but we're getting more real. Now I see electro dark field microscopy x-rays of biological organisms, such as a leaf. And they cut part of the leaf off, and you can still see the biofield of that leaf still there. Well, And you see the spark, those videos of a embryo being born, and you see a flash of light. And if you changed frequencies, you could see you'd see a biofield around that cell. And as we grow, and they've also done research on these polywogs and frogs, and they've messed with their biofield as they were growing, and the eyes grow in the wrong place, and they get wonky. And they've done it wrong, but they've also done it kind of right, where they've had frogs grow arms out of their skin by emulating the biofield. In the research, they say electricity, but really, we know they're manipulating the biofield. Okay, so you take all those data points together, and what you just said is how every cell has got its own field, and together they make this whole holistic. And we're getting good at frequencies. We can put a tune right in there for the cells to resonate a little happier, a little less happier. That's where I'm coming from. Please tell me more about how you understand it, maybe in that context, so I can understand it.
Yeah, I don't know about that because I can't help you.
Right, like the biofield it's like there's so much points of interest around it. It's so fascinating to me. And then in your office, you're saying to patients, hey, it's not a suppository, we can add something to your field and help you, and like a little tip will go a long way.
Yeah. So one way we're using frequencies in our office quite often, so often patients' vagus nerve is turned down, okay? It'll be turned down because of stress, infection, trauma, and so the vagus nerve isn't working properly for them. And so they're going to have all kinds of issues when their vagus nerve isn't functioning, especially digestive issues, gut issues. And so when we're using frequency-specific microcurrent, we can actually support the vagus nerve to return that vagal tone. Because those patients that are in chronic fight or flight, they know who they are. They're always in that sort of hypervigilant state. They're always in that. They're stuck in fight or flight, that sympathetic dominant state. So we can help with that by stimulating the vagus nerve, by increasing vagal tone. And we do that with frequency-specific microcurrent by using the frequencies that address the vagus nerve.
Wow, yeah. How does those vagus stimulators, is yours a stimulator or is it?
No. So frequency-specific microcurrent conducts the current, the electrical current through the body, through the water in our body, through hydration, right? And so what we do is we put wet towels around the body, depending on what area of the body we're trying to treat. We'll put wet towels around the neck because the vagus nerve runs down the neck here. So we'll put wet towels around the neck, and then we'll put a wet towel at the lower abdomen because the vagus nerve runs down to the pelvic region. And then we'll attach the leads to the wet towels, and then the current will flow through the patient's body from the towel to the one towel to the other. And they can't feel anything. You can't feel it, you can't hear it, you can't see anything, because it's the same kind of current, the electricity that's in our bodies right now. We can't feel that. And so you can't feel the current as it's flowing through you, but it's healing and repairing while we're running the current.
And patients after this therapy, like, what do you see?
So it's not a one-time, you have to do, several treatments. Usually average requires twice a week for 4 to 6 weeks is usually an average treatment.
Yeah. Wow. Powerful stuff. I've heard so many things about it from so many different people, and there's different versions of it. I got to get back into it. That sounds like a cool science.
We can even use it with dogs and cats and horses, not just for humans.
Yeah, which is a tangent of our original story that the really good machines are for veterinary use, the PEMF and some of the, not the one you're using, but people trying to skirt medicine. I've seen a lot of animal PEMF machines marketed to humans, which is interesting. But that's not PEMF. I know microcurrent. I'm with you. Any other therapies for women that are singular?
Specifically for women,
women's health, longevity, feeling better, thyroid, hormones, exercise are the big ones we talked about. All right. And other gizmos you're considering buying or looking at?
I'm not looking at anything new right now. I have a lot of gizmos already. I would have to say ExoMind is my favorite device, advanced technology right now.
Tell me more.
Yeah. So ExoMind is transcranial magnetic stimulation, or TMS therapy. It's the newest generation of TMS therapy. TMS is not new technology. It was invented in 1985 in the UK, and millions of treatments have been performed around the world for the last 40 years. So TMS is not new. We've been using that for 40 years for mental health. But ExoMind is the newest generation. And with ExoMind, we're restoring healthy brain activity and enhancing neural connections, because when those neural pathways are weak, we're seeing anxiety, depression, brain fog, poor sleep, cognitive decline, ADD, OCD, PTSD, binge eating, food cravings, addictions. And so with ExoMind, what it does is it promotes neuroplasticity. It stimulates the brain cells by using a powerful but gentle magnetic energy to stimulate brain cells to create those new healthy connections. And it also promotes the release of BDNF, brain-derived neurotrophic factor. It's been dubbed Miracle Grow for the Brain by Dr. John Stakey in his book, Spark. And so with ExoMind, we're able to help patients without medications, without those side effects. The ExoMind is being the newest generation. It's different than old versions of TMS therapy, because old versions were where they were loud, they were bulky, they were painful. And so when patients did the old versions, it felt like banging on the head. And so they would leave their treatments with headaches. It was also very loud, so they would have to wear earplugs during their treatments. And because older versions were so inefficient, they had to do 1-hour sessions every day for 7 weeks to get 36 sessions in. And some people needed more than 36 sessions. But ExoMind is now very comfortable and more efficient. So patients, when they do their treatments, it's very relaxing, it's very comfortable. My patients usually fall asleep during their treatments. They don't have to wear earplugs because it's very quiet. And because it's so much more efficient than the older versions, patients only need 6 25-minute sessions, not the 36 1-hour sessions. And so it's much more accessible now for patients.
That's amazing. That's amazing. Patients that are a good candidate for this therapy, how do they present?
Anybody is a candidate. So if you've got brain fog, if you're burnt out from your job, if you are having, some trouble sleeping, anxiety, depression, stress, any of these things, So there's nobody that this, couldn't help. But we don't use it in patients if they've got any metal implants in their head, if they have a seizure disorder, we don't use it. But really anybody is a candidate for it.
And it promotes neuroplasticity to get to your healthier state?
Yeah.
Excellent. And they can come to you for those therapies.
Yeah. Because we believe true wellness isn't just about physical wellness. True wellness is also about physical health and mental health. You can't be truly well if your body's healthy, but your brain is not healthy. You can't truly be well. And so we're going to address mind and body.
I love that you're helping your patients achieve their potential with your tools, your education, your history. I love talking to healers, people that want to help patients for the sake of helping people. And I'm grateful you're there, Doc. We've had a wonderful hour talking today. I appreciate your time, and I love the conversation.
It's been a pleasure. I enjoyed it.
All right. Be well.
I would love to talk more. Yeah. Thank you so much.
Thank you, Doc. Be well.
Bye-bye.